All right, good afternoon, everyone. Thank you so very much for coming today. Former Congresswoman Brooks, who has served as our commission's citizen advisor, had planned to be here today, but felt compelled to be with her good friend's family. Yeah. You know, Indiana and public health lost a really tireless advocate yesterday with the loss of Congresswoman Walorski. She got my private cell phone number, and about, I don't know, 6 to 10 times a month, she would text or call me. And she always wanted to know, what do you need? How is the federal government providing what they need to do? Are they doing a good job? And what do I need to advocate for? She was an incredible public health advocate for us throughout the entire pandemic. Her passion for the Hoosiers' well-being and for health is really what this Governor's Public Health Commission is all about. We lost a huge champion, but we have the opportunity to continue her work, and we will do just that with this commission. I wanted to take a minute to recognize some of our Public Health Commission members who are here today. We had a really great show, so I'm going to start in the front row, and Kara, start with you. And if you would stand up and just, tell them your name and then maybe who you represent.
I'm Dr. Kara Beal. I serve as a CEO with the Indiana Rural Health Association. We represent rural healthcare across the state of Indiana.
I'm Mindy Waldron. I'm the Deputy Health Commissioner of the Allen County Health Department and representing local health departments and the local health department administration group across the state.
Dr. Hannah Maxey. I'm an associate professor at the Indiana University School of Medicine, where I also serve as the director of the Bowen Center for Health Workforce Research and Policy.
Dr. Dave Welsh, a general surgeon for Batesville and health officer for Ripley and Franklin counties.
Well, I'm Madison's Mayor Bob Courtney. We're located in the southeastern part of the state, and I'm representing the community of Madison.
Carl Ellison. I head the Indiana Minority Health Coalition. We are a statewide organization in health disparities and health.
Hi, everyone. I'm Kim Irwin with the Indiana Public Health Association, representing the public health workforce broadly and partnerships and stakeholders. Thank you for being here.
Thank you so much. So today we're formally announcing that we submitted the report of the Governor's Public Health Commission to Governor Holcomb, containing the recommendations to improve Indiana's public health system and ensure that all Hoosiers have access to those essential public health services that they need to achieve their best health. When Governor Holcomb established this commission just a year ago this month in August, our charge was clear. We were to fully explore the strengths and the weaknesses of Indiana's public health system, including the routine delivery of public health services and the response to the COVID-19 pandemic, and to make recommendations which would strengthen our public health system going forward. While this work has examined the challenges that the COVID-19 pandemic presented to us and further exposed those inconsistencies in the delivery of equitable public health across the state, it's important to note that those disparities did not start with the pandemic. They existed before the pandemic, and they are going to exist long after the pandemic is well in our rearview mirror if we do not make some changes here in public health in the state of Indiana. For example, many of the gains in longevity across our state and across the United States and really the world is attributed to advances in public health, such as motor vehicle safety, ensuring cleaner water and sanitation, decreases in heart attacks and strokes, which has been a more recent decrease secondary to focusing on smoking cessation and identifying high blood pressure earlier and treating that. However, Indiana's life expectancy has actually been decreasing since 2010, and we currently rank 40th in the nation for life expectancy. This graph, which is borrowed from the usmortality.org, shows the US in blue and the Indiana in red. In 1959, you can see that Indiana's life expectancy at birth was about 70.5 years, and we ranked 18th highest in the nation. We were higher than the US average then. Until the mid-1990s, Indiana's life expectancy kind of mirrored the US average life expectancy, but we have been diverging from that in the US ever since the mid-1990s, such that our life expectancy of 77 years in 2019 is nearly 2 years below the national average. More importantly, the difference between our county that has the highest life expectancy and our county that has the lowest life expectancy is almost 9 years. And while we have seen gains in life expectancy in Hoosiers who are 65 and older, and that's important, the age group where the life expectancy in our state is going down is our working age Hoosiers. Those that are 24 to 64 is where we've actually been seeing our life expectancy decline. This 100-page report reflects the completion of 10 months of research, collaboration, and listening. And as a result, we developed recommendations in 6 key areas of focus: workforce, funding, governance, services and infrastructure, emergency preparedness, data and analytics, and childhood and adolescent health. Senators Kenley and Dr. Monroe and I will walk through these recommendations in just a moment. But before I do that, I want to emphasize that Indiana does do many things well. Our public health data and analytics became a shining star throughout the pandemic, and many states look to us. We have had incredible public health professionals across our state. These are some of the most dedicated people you will ever meet in our state. They sacrifice their time and their own needs in order to be able to help their communities. And I think they deserve our gratitude. But more importantly, they deserve our support. Our goal is to build on the advantages that we currently know that we have here in the state and address the gaps that we have identified so that every Hoosier has the same opportunity to achieve their best health. We look forward to sharing these recommendations with our legislators and to working hand in hand with them to make Indiana a leader in public health. And now Senator Kenley has some remarks.
Thank you, Dr. Box. Before I start, some of you may wonder why I'm wearing a hat today. So in order to alleviate your fears, let me show you what's going on here. I don't know, Dr. Box, if you have any advice for me or not, but
Sunscreen and a hat, maybe, sir?
a little public health probably would have motivated me along the way. So over the last 25 years, Indiana government has done an admirable job of building a better state with better job and business and living opportunities for all of our citizens. Some of the notable things that we've done are strong funding for our public schools, development of school choice alternatives for families and young people, a significant investment in higher education to build a stronger higher ed system with many building projects at our public universities, coupled with a strong student aid and assistance program of over $400 million a year for students at both public and private universities. Indiana's public university system, from its facilities to its classroom performance, is top of the line in America and the Midwest. We have invested in infrastructure, improving and funding up our roads and highways to make Indiana truly the crossroads of the nation in our supply and logistics industries. And we've successfully achieved all of these things with balanced budgets and moderate taxes. We've had strong business development and job opportunities through the IEDC, development of a better, more business-oriented tax policy, strong fiscal efforts by the state with balanced budgets, low taxes, at the same time reducing state debts. Now, all of these things have been accomplished to make Indiana a leading economic producer and a great place to live and raise a family. It's not by accident that in the last census, Indiana's population grew faster than any of our surrounding Midwestern states. I think that's just a voting measure of the approval of what we've done here. But when the governor came to me and he asked me to co-chair this public health commission, I said, why should we take this on? That's a pretty tough subject, especially in light of this pandemic and all of the excitement that that's created. I pointed out that he was a lame duck, and in his second term, he could go play golf or basketball or whatever he wanted. And his response as to why we were doing this was because it's important. So we talked a little bit about it, and I said yes. And going on faith in Governor Holcomb, a man of his word, not realizing how truly important this effort would be. And I was shocked at the things that I learned and found out about our public health system here in the state of Indiana. And unfortunately, as Dr. Box said, the need for improvement. But as we worked through our monthly meetings as a commission, I came to really learn why it was important. Indiana ranks virtually last in public health expenditures on a per capita basis. Counties have statutory duties and preventative health delivery requirements with little funding. The level of service varies widely from county to county, and there are gaps in services in critical areas like EMS services, school nursing. And in fact, from my perspective, if it were not for the Herculean efforts of Dr. Box, the health department, the governor's office, local county health providers, and with the assistance of many private companies, including hospitals and doctors, Indiana would not have fared anywhere near as well as we did during the pandemic. Because of all this and the things we learned, it's clear that we need to change and improve. Our success in so many other areas demands that we have an equivalent public health delivery system that matches up with the rest of our achievements in this state. This is part of having a state that will be attractive, continue to grow, and one where our citizens enjoy a good standard of living. Indiana does not have a poor public health delivery program due to anyone's fault. It's merely a system that came about over many years with little realization about how our society would change. It lacked the ability to grow, react, and provide all the preventive health care assistance that we can and should expect. 64 of our counties have populations of less than 50,000, and 30 of those are less than 25,000. So 2/3 of our counties are so under supported with a tax base and the expertise that you need to do this, that it was really almost impossible we could achieve what we needed to. Funding in the past has been mostly a local responsibility, and county government has been required to raise the money with many other priorities competing for the same dollars. That we need to develop a better system is clear from 1 year's worth of meetings as a commission. I need to add that Dr. Box, Dr. Monroe, my co-chair, and Congresswoman Susan Brooks, who was our citizens representative, and our commission members, many of who are here today, have been outstanding in their participation, attendance, knowledge, and in putting this recommendation together. We also owe a big thanks to our staff headed by Shane Hatchett, and I cannot praise their diligence, wisdom, and commitment too highly. They raised many concerns, and we heard the same concerns echoed throughout the state as we made 7 listening tour stops. And as we presented, Dr. Box and I, more than 30 briefings to all kinds of groups, including elected officials, business associations and groups, healthcare associations, the Indiana Minority Health Commission, and many others. It is clear that we need more state support in terms of dollars and participation, and that we need a partnership arrangement where all stakeholders get involved. The bulk of the funding needed just to bring our funding into the mid-range of funding on a per capita basis in the states needs to come from the state. I made that statement at the presentation that we made for the Indianapolis Chamber of Commerce, and some of you may know Joyce Irwin, who was a lobbyist for Roche for many years and now runs a foundation here in central Indiana. And after the meeting, she came up to me and she said, "Oh, Senator Kinley, are you asking for more money?" She thought that was so contrary to my nature that it was like a recordable event. So I would share with you that if you think that if you are one of those who know me as other people have, and you see me making this request, you know that I would not make it without the utmost sincerity, conviction, and belief that this is a necessary element to us having a good state in Indiana. And so if we would do this, this would reflect the standard of the most successful states in delivering a good public health system. The Indiana Department of Health needs to develop programs, assistance, and provide a regional staff support base for our county health departments. The most effective retail delivery system is right there in the local health department, where you're close to the people. And in part, because of the smallness of 2/3 of our counties, that assistance from the state and that type of a structure becomes even more important. We need to be partners with the local health departments, and we need to be partners and have the full accord, agreement, and partnership of our locally elected officials. I think you'll see that our recommendation stresses this as the governance and financing structure of how we can get this done. I am so pleased with the finished product that the commission brings to the governor. I hope that this helps Governor Holcomb in his steadfast and forward-looking leadership on behalf of our state. We stand ready to meet with any of our legislators to review our recommendations and hope that they will also see how a good partnership public health system will complete this loop regarding Indiana's efforts to meet the needs of our citizens. We encourage the legislators to talk to their local health departments and their local elected officials and get involved in this effort. Our goal overall is to improve and enhance equitable delivery of public health foundational services across our great state of Indiana. To do that, we will need to improve state funding, and we will need to develop the partnership delivery system that the recommendations contemplate. So thank you for being here today. Dr. Monroe.
Well, thank you. Good afternoon, everyone. I'd like to begin my comments with congratulations to Governor Holcomb for his leadership for establishing the Governor's Public Health Commission. And for me personally, it's been such an honor to serve as co-chair of the commission, along with such public servants as my co-chair, Senator Luke Kinley, your state health commissioner, Dr. Chris Fox, and Congresswoman Susan Brooks. And I also want to echo what others have said about the members of the commission who were incredibly dedicated, came to every meeting, and it was a rare miss to have someone not in attendance, stayed engaged throughout the process, and attended many of the listening sessions to go out into the state to hear what folks had to say. So I want to thank them and thank Shane and the others at the State Department of Health for incredible support. I have to tell you, throughout this process, one of the things that really struck me was how deeply everyone on the commission cares about Indiana. They care about the health and the prosperity of the state. And when we look at public health over the last century, public health has essentially given us an extra life. If you go back to 1920 to 2020, in that century, globally, the human lifespan was basically doubled. That's an extra life, which is beginning to slip away. Those gains are slipping away, as Dr. Fox showed you in the slide. So it's also been a really special privilege for me to come back to Indiana for this work after spending so many years of my career here in the state, as well as raising my family here in Indiana. Over the past year, I have to tell you, I've had numerous friends and colleagues. One, they thought I'd move back to the state, so they want to know where I was living now. But folks that I worked with when I was on faculty at Indiana University, when I was on staff at St. Vincent Hospital, and of course my colleagues across the state when I served as commissioner, and many of them, a lot of our friends in businesses across the state, and particularly in healthcare, practicing physicians, wanted to let me know how much they appreciated the work of the commission. They would reach out to let me know. But I also had some of my friends that practice medicine saying to me, I sure hope the commission makes a big difference. I hope your recommendations really do improve public health in Indiana. Because they express stories as an example of when they would have patients that would need orthopedic surgery who couldn't go to surgery. They couldn't take them. It wasn't safe enough to take them to surgery because of either the multiple chronic diseases or particularly obesity. And then the result of that is that they can't take them to surgery. You now have folks that become disabled in the state. And so this is a system, and we need to begin with healthy children and helping have systems in place in public health for people to be healthy throughout their lifespan. So I did serve. I remember being in this room many times. And as your state health commissioner under Governor Mitch Daniels from 2005 to 2010. And I have to tell you, during my tenure, we dealt with many of the same issues that I heard reported out by the experts throughout the work of the commission. Rising rates of adult and childhood obesity, persistently high rates of tobacco use, emerging infectious diseases, and I can tell you there will be more of those. We're clearly in an age of expanded infectious disease and deaths from drugs, alcohol, and of course mental health and suicide. So of course, we all know that the pandemic has brought public health into the daily news cycle, as well as disrupting all of our lives. And that in turn has brought a lot of attention to public health, which has, really has brought to the forefront this need for modernizing public health across the country. So there are many, many national conversations taking place now about how do we modernize public health and how do we do a better job supporting and designing public health with what we know today. We have technology and science today that, quite frankly, I couldn't have even imagined when I was state health officer. I mean, that's how things have advanced. But then there's the basics that we need to supply. Public health started, and that extra life, it's because of clean water. It's because of the fundamentals that public health brought to health. So governance, funding, forecasting, and data systems, strengthening the public health workforce, and preparedness are all issues that we discussed during the commission, but those mirror the conversations that are taking place nationally. The CDC Foundation, which I serve as the CEO, convened a series of national summits earlier this year on the future of public health. And we named this series Lights, Camera, Action, the Future of Public Health, with the aim to shine a light and focus the lens on the exemplars moving to a positive future and identify the actions that we should all take. And I have to tell you, in my work, I am asked regularly about the work in Indiana. Everyone across the country, what's happening in Indiana? What's the commission doing? How is the commission going about their work? And I am so proud to be able to answer that the Governor's Public Health Commission in Indiana took a very holistic review of the strengths and the weaknesses of public health in Indiana, matched that to the core of what public health should be, looking at the foundational capabilities that should be available to everybody in the state, in every community. And the commission, again, my hat's off to our commission members. They were everyone was thoughtful and deliberate about making recommendations that position Indiana for the most meaningful change possible. So the national light is shining on Indiana, and the camera is focused on this report that's being released today. A lot of folks want to see what the recommendations are. And I would just end by saying this is an amazing opportunity for Indiana to lead the nation and be a positive force.
Thank you, Dr. Monroe. So we were going to run through some of the basic recommendations under each of the areas. Do you, Senator Kinley, want me to just run through those on the governor's, or do you?
Okay,
Here's the public.
thank you. So some of the concerns that I had dealt with really two things. And once I became convinced that the case had been made that we needed to do this. And one was, how do you structure the governance and deliver the services? And the second one was, how do you fund this up? And it seemed that we needed to take advantage of the good things that many local health departments had done, but that they needed quite a bit of assistance. And so we feel like the State Department of Health, that when we pass this next budget, we hope to convince the legislature to appropriate money to execute this system, and they would send the money to the Department of Health. The Department of Health would use that money to provide additional staff and resources. And then we have health districts, 10 health districts in Indiana that are somewhat comparable to the congressional districts. And we would have people working in each of those areas who would be liaisons, instructors, assistants to the local health departments, and that they could help present and deliver the programs on a county by county basis. One of the things that we felt was absolutely critical that we heard about was sort of the disconnect between the county elected officials and the delivery of the service. And so we felt that in order to have this done, we needed to have sort of a true partnership arrangement. We need to have the State Department of Health, we need to have the regional delivery system, the local health departments, but we needed to get the local county elected officials involved. So part of our recommendation is to ask the county legislative body, the county council, to take a vote to agree to participate in the program and to be able to access the funds under the guidance of the Department of Health to deliver all the programs that we envision. So rather than mandating on local government what the Department of Health is going to do, or just taking over health departments, which we do not intend to do, and we think would actually be a step backward because we would lose that touch and relationship that we already have in each county, that we would have the local elected officials become a partner in this effort through the approval of the process and participation on that basis. So we think that that is a governance structure that will give us an opportunity to work in a positive way. And I think an additional thought is that as we went through the commission proceedings, it was clear that some of the outside groups like the Hospital Association, some of the doctors associations, they started getting more interested in this because they felt that if the local health department was the delivery service and we had a program that was well put together, that there would be a reason for them to be more transparent, more communicative, more working with on a regular basis the local health department. So we think that this partnership can extend beyond just those named participants. And so we're hoping to develop a governance structure along those lines. With respect to the funding, and these numbers can be massaged a little bit or disputed a little bit, but in reality, Indiana is virtually in the last 5 of the states in the nation funding for public health on a per capita basis. If we were to raise the per capita funding for each individual in the state of Indiana, 6.8 million people, by $36 a year, that would put us kind of in the middle of the road. Many times in the past, I know in the legislature, our challenge has been to our agencies and the executive branch is, look, we'll fund you up so that you're at least in the middle and more toward the top if you find things that you need to do. But we expect that you will take the money and more efficiently, more effectively, and do a better job of using it than most other states. We want to be a better run state. So if we fund you to the middle, you should be able to deliver a high quality service. So the $36 times 6.8 million people is $242.6 million a year to be dedicated to public health in the state of Indiana. Now that's a big ask. Quite frankly, other than our K through 12 funding formula, I don't think Senator Charbonneau was in the front row. He served on appropriations with me. I don't think we ever put that much money into a program. If you think about how the health and the welfare of the community relates to good business opportunities, good education opportunities, good family development opportunities, probably the next thing on the list is a healthy community. And so we need to kind of close the loop of making Indiana be that superior state in terms of what types of population we have and the satisfaction we provide to people. So I think, Dr. Box, that's the essence of what we're suggesting here. Do you have anything you want to add to that?
No, I think we just talked about that the bulk of the funding would go through to the local public health
That's right.
departments so that they could build out their department. And make sure that they were able to have the staff and the resources that they needed to
Right.
provide it. And I think what we talk about a lot is that if you invest $1 in public health, the return, depending on what literature you look at, is anywhere from $7 to $14 in return. So it's not just about healthier Hoosiers and probably a healthier workforce, but also in general, from an economic standpoint.
And that's a good point. And in addition to the sort of the return on investment you get from having a healthy society, because of the local departments are so understaffed and so unable to do many of their daily functions, there are things like Medicaid reimbursement that we could see that we're not seeking today. And if we have a structured, organized system, we can make money there to offset the actual cost of the system. But I felt like it was only honest to go to the legislature and say, here's how much we think this thing would need to do the job right and start there.
Judy, you were going to talk about some of the recommendations under the workforce and the data.
Yeah, so workforce is an area that is critically important. And Indiana had severe workforce shortages prior to the pandemic, which were exacerbated as a result of the burnout and other pandemic-related issues. So in order to better understand the extent of these issues, a comprehensive assessment of existing workforce needs to be completed, really needs to be completed, including salaries and job descriptions, FTEs and time allocation. So that's part of our recommendation. A comprehensive workforce plan will be developed to enhance recruitment, training, and retention. Again, thinking systematically and comprehensively is really important, and you see that throughout the commission's report. And then the commission also recommends evaluating the efficiency of healthcare professional licensing in the state, are some of the workforce recommendations. Then on the data side, which is again really important, the ability to collect, report, analyze, and access data across the public health system is critical to risk identification and development of actionable plans to improve and protect public health. Recent pandemic, of course, underscored the importance of data. So we will establish through these recommendations a public health data system advisory committee to ensure data governance across agencies while maintaining appropriate privacy protections. We heard that loud and clear in our public listening sessions. Folks are concerned about privacy is be front and center, and security protocols. We also recommend formalizing our relationship with the state's health information exchange to promote improved clinical outcomes and outbreak management. And one thing that we heard frequently from local health departments throughout the pandemic was that they wanted easier access to the data that they actually submit. So another of our recommendations involves developing data analytics tools and resources for local public health and communities to use as they convene to address the health and safety of their community. And many of those recommendations dovetail with the workforce, because you need the workforce to be able to have the to manage data and understand the analytics. So,
thanks. Thanks, Dr. Monroe. I'll do the last two and then we'll take questions. Emergency preparedness was not just about how do we better prepare for the next public health emergency, although that was a very important part of our discussion. But many Hoosiers don't realize that the leading cause of death for Hoosiers ages 1 to 44 is trauma and injury. And that EMS group that picks you up, how quickly they get to you, how trained they are to stabilize you and get you to a hospital that may be a trauma hospital, maybe just a hospital prepared to stabilize you, to get you to a trauma hospital, makes a difference between your life and your death and your permanent disability. So we really looked at that and saw a significant shortage of EMS throughout our COVID-19 pandemic. And that was a shortage that existed before, but was really exacerbated. In the past, the way things were, there was a lot of sharing of EMS services across county lines, and that has really gone away because of the shortage, and counties are just not willing to let their one ambulance service go to another county or to transfer someone to a higher level of care. So the need to address the workforce for EMS and also the hardware, the actual transportation vehicles is important. We also really saw that it's very important to look at the fact that emergencies don't respect state lines or county lines, and that a lot of emergencies occur around Chicago, down around Louisville and the Cincinnati area, and they need to be able to be better coordinated across that. So an improvement in our trauma system, be able to respond to that. COVID taught us the importance of having our own state strategic stockpile. It was nothing worse than sitting here and wanting to be able to get from the national strategic stockpile personal protective equipment and not having that. I can tell you personally, it was one of the hardest things about our position. And the state strategic or the national strategic stockpile was never designed to make sure it could cover every state at the same time for all their PPE needs or their medical countermeasures. So one recommendation we've had is to look into that and consider establishing a state strategic stockpile. We also recommended that it's important to look at the way the organization occurred in the state with regards to the state down to the district or regional emergency preparedness, right into the local community preparedness. And there was not as good a coordination as we would have liked to have seen in our state or in any state, really. And so the importance of really redefining those roles and responsibilities and planning at that district level is important. And then lastly, childhood and adolescent health. You know, Indiana's ranked 29th in the nation since 2019 for overall child well-being. But when you add in the health components of that, whether that's childhood obesity or child and teen deaths, that brings us down basically to 36th, making us last among all of our neighbors. We know that suicide is a number 2 cause for our children ages 10 to 19. And we know that injury is the number 1 cause. So not wearing your bike helmet, not being in your seatbelt, driving under the influence. And we know that schools are a crucial part of that education and delivering public health. And studies show that students that are healthy learn better. So one of the stories that really resonated with me was a local school nurse down in the southeastern part of the state who said she really was the only healthcare for a lot of her students. There just was not access to family doctors and other people. And so she's actually going back and getting her advanced practice nursing so she can even provide more care for her students. But I think it really underscored the importance of our schools and the integral role that they play in their communities with regards to public health. So the commission recommends that we increase or improve the ratio of school nurses, counselors, and social workers to students so that we can address whole school and whole child wellness, that we support evidence-based education for health needs, nutrition, and physical activity in the early education settings and in our K through 12 setting. And then also recommended that there's even required screenings that many times are getting waived, visual screenings and hearing screenings, that we help to facilitate our local public health and our local schools to be able to make sure those screenings are being included, and maybe even branch back out to doing things like education for dental health and screening for dental health. So those are the last of the recommendations. I know we've been talking for a while. We give you some time to talk, but I just want to say that these recommendations highlight what is coming from the report, that it represents an incredible amount of work by the commission and by the IDOH staff. Work is really just beginning. We see this as a relay team, and we're just now passing the baton on to start working with our partners in the state and establishing those things that we can do without legislation, but then working very carefully to transform these recommendations into potential legislation for the 2020 session, so that we will be able to allow every Hoosier to live their best healthy life possible. Thank you, and unless we put everybody to sleep.
Hi, John Russell from the IBJ. Just want to make sure I'm clear on a couple of numbers. Senator Kenley said you want to increase funding by $36 per person, which would total $242.6 million a year dedicated to public health. Are you talking about state dollars there? Are you asking the legislature to give you an additional $242.6 million?
I think that's what you have to do in order to get this program developed. And, you know, I kept multiplying that number out myself a number of times trying to make it be smaller, but I couldn't do that. And so if we do invest that much more, and it would go not only, it would go to the Department of Health, but it'd be used all the way down to the local offices for the delivery of services. Remember, right now, almost all of the funding of your local health department comes from the county budget. And so it's very poorly funded because of that situation. There are so many other competing needs, and so many counties don't have the asset base in those 60 some odd counties that just don't have a big population that they can sustain that. If you look across the country, the models show, even in states where they don't deliver a very good public health system, that most of the funding comes from the state itself. And we happen to be an exception to that rule, and it just developed that way because of the old statutes and the way it said you did it. So you heard me right. That's what I said, and that's where I think we need to start.
So what is the current budget of the Department of Health?
I don't have that number off the top of my head for our local health maintenance fund, but I can get that. I should have that. I think another really important part of this, though, is that we didn't hear that local health departments just needed increased funding, but what they needed was consistently increased funding. It can't be something that is just an infusion of money like a grant is. They can hire people for 2 or 3 years and then that goes away. We need some consistent funding so that we can train and have the staff available that can then apply for those grants from the CDC and other places and can then use that money with their existing workforce to actually do a program or a plan. And so it's the increased funding that's consistent and also accessible to them.
Last question on this, on these numbers. So how much of the extra 242 million would go to the local health departments, and where else would it go at the state level?
Well, what we've laid out is a system of governance and service delivery that really changes the dynamic. For example, we do not currently have any regional assistance personnel to go out to the county health department and help them. So some of the money is obviously going to have to be spent to develop that system, and some of the money would be spent right at the local health department. The whole objective of the thing is to provide a delivery system with the local health department as the retail store. If you look at it like a private business, you know, you have your headquarters, your warehouse, and then you have your retailer out there. And so we think the money is all in support of the retailer. And at this point in time, it would be hard to say how much is going to end up in the local health department. But I can say this much, 100% of the money is designed to deliver the system from the local health departments.
Other questions? Yes.
Hi, Leslie Bonilla with the Indiana Council. Big question. Basically, are you worried that legislators will be ignored the results like they may have done with, and or how did you approach this to try and sell it to the people? Because as you guys have emphasized, trying to transfer these into laws.
Sorry, in addition to having Band-Aids all over my head, I can't hear. So
I could re-say.
yeah, you need to speak really loudly because I barely could hear that you were even talking.
Okay, thank you. Curious, like how you're going to sell, how you approach this to sell it to legislators, and if you're worried that they're going to for it, like maybe teacher.
Okay, well, I think I heard at least part of your question, and I'll get Dr. Box to help me on some more of it. How do we sell it to the legislators? And part of our initial planning was that in order to be able to sell this to the legislature, because really their opinion in the end is the one that counts. We need 26 votes in the Senate and 51 votes in the House. And the way we need to sell it to the legislature is we need to create an awareness and a knowledge of what our current public health system is like, what it needs to be, what it should be, and how can we get there, and what can we do. And part of our plan was not only for the commission, which held their meetings publicly, and Shane kept a website open, and we took comments from the public at every meeting. In the next meeting, we went through all of the public comments to see what people were saying. We had the listening tour. Was it 7 or 8?
7.
We went to 7 locations, and we really did not talk. We were just there to receive information from the public in all these different locations around the state as to what they thought the needs were. And then we went to these 30 to 40 groups of people, and we tried to educate them on many of the facts that you've heard today about what is the current condition of our system. So what we have tried to do in order to be prepared to go to the legislature is to build up a system where we have all our facts straight. We have a plan set up and we know we need to execute. And then we need to convince people that this is the best thing they need to do. And so that's why in my comments, I said, we asked the legislators to talk to their local elected officials, talk to their local health department, find out what they think their needs are. We think that if we can persuade local elected officials like the mayor, your Mayor Bob Madison, who was on our commission, and it was his and the 2 county commissioners we had, they were of great assistance in analyzing how do you approach these people to find out what it is they need to know in order for them to turn around and encourage their legislator by saying, look, we've talked to the health department, we've seen what's going on, we've seen the plan, we think it's really going to help Hamilton County or Du Bois County or St. Joe County to get where we need to go to have a good system. We think it's integral to the economic development that we have in all of our areas and all across the state. So we're trying to get the information out and this be a broadly based enough thought process that by the time you get the legislators, that they will come to us and they'll say, this sounds good. What do we need to do? Or here are my questions and how do we answer those? So it's a process. And Governor Holcomb has shown a lot of courage by even establishing this commission. He could have easily ignored this problem and just let it go to the next person. And so that's kind of our overall plan. I hate to give away all my secrets at once.
And Senator Kinley, you and Micah Burkert, after every one of our commission meetings, gave a wrap up to all of our legislators and our health committees, sent out a report about that. We have, you have met with many of them about this and discussed it. And I think it's telling our legislators, especially for instance, our rural legislators, EMS is an issue. This is the #1 cause of death for Hoosiers in your area from 1 to 44. It's important that they have someone to pick them up and take them to a hospital, someone to stabilize them and get them to a higher level care if they need it, so that they do have a chance to survive and not have long-term disability. So I think it's pointing out what resources and what services should be there that aren't there right now that we're trying to.
You know, coming out of a pandemic where we've had, the nation was just so shocked by some of the things that were considered to be necessary to deal with this epidemic that we had. And there was a question about mandates and masks and all these things. So this is maybe in some ways kind of a bad time to say, gee, we need to revamp our whole public health delivery system. The reality is this is actually the very best time to do this. And one of the things that we're trying to do is to make sure that we communicate and listen to people so that we are not into mandates as an approach. We are into a partnership approach. We think that's very achievable. And so that's how we plan to go about doing this. Another question that came up in the listening sessions, and I know once I talked to some folks and then other times I saw Dr. Box talking to people, people would get up and they'd say, well, I'm worried about public health because you're going to interfere with my relationship with my doctor, which is a private relationship. Or when you collect data, you're going to collect data about me, and that's my information. And so we're very respectful of those legitimate comments, and we think that we're designing a plan that is sensitive to those things, takes those ideas into account, and does not intrude on those thoughts as to how people should be. So it's been quite a process, and but we're just getting started on the real work now, and at least we've got a report to work from. And I think we've got a good plan that if people will sit down and listen to us, and what we want them to say is, you know what, this is going to be good for Indiana. It's going to keep us on the right side of things, moving forward, developing a good state, increasing our population, getting a healthier population, getting better jobs, attracting businesses who want to come to a state where they do things right. So we think all those things, which is basically the formula of those 4 things that I talked about that we've done in the last 25 years, it's the same thing, only it's one more step in that process, and it involves the health of our citizens.
What's the timing on this? Are you planning to make put in the request for the next budget?
We'd like to give the governor a chance to think about it first.
So you're giving it to him and let him make that proposal in his budget.
We're giving the report to him, And as I said in our comments, we have confidence that if he were willing to establish the commission, that he has some interest in these things. And then hopefully he will use the hard work that we've put in the past as part of his marshaling force to help sell this to the legislature. And I'm not sure if he will have exactly the right view of that we do of this, but this is the recommendation, this is the suggestion, and the governor will give us our marching orders.
And when he established the commission, one thing he asked us to do was develop some language that could be used in the 2020 session.
Sorry, like, what did you mean by exactly the right view
Sorry?
in regards to the governor?
What do you mean by, what did you mean by exactly the right view? I think you're trying to say his view may not be exactly the same as the commission's view. We don't know whether he'll want to adopt everything in there or what parts of it he would be interested in.
I think the governor deserves to have the latitude and the flexibility to just say, I like your plan. This part of it looks to me like it's very doable right now. Here are other things on my agenda that may cause me to want to reconsider what we do first, when and where. And I think we, out of deference and respect to his office and all the other responsibilities that he has, we need to give him the opportunity to help decide how far and how fast he wants to go.
Any additional questions or comments? All right. Well, thank you guys very much for coming today. We appreciate it.